Well, I chose family medicine mostly because going through medical school, doing all of our rotations that we do, I could not pick one specific area that I really enjoyed as being a specialty. And so with family medicine, I have the opportunity to do everything from children to elderly and all the in between, from sports medicine to the sick colds and the high blood pressure diabetes. I enjoy doing it all. I'm originally a Delta girl. I was from Greenwood, Mississippi, born and raised. From there, I went to Delta State University in Cleveland, Mississippi. Received my 4-year undergraduate degree there with a major in biology, chemistry, and mathematics. During that time, married my high school sweetheart. We were admitted to medical school here in the University of Mississippi in Jackson. So we've been in Madison now for a little over 8 years. Finished my med school degree at University of Mississippi and then finished residency in family medicine in 2009 from the University of Mississippi Medical Center, and have now been at the Baptist Medical Clinic in Madison since September 1st of 2009. And we really enjoy it. My philosophy for patient care really is just to really develop relationships with my patients. I really enjoy getting to know them, their family members, seeing all of them, at several different occasions. And, I've thought about, what if I were in urgent care or, some sort of different practice than what I'm in now, and I would miss the patient relationships. I think my biggest philosophy about what I do is making relationships with my patients and continuing those for several years, over time, just getting closer and closer. As far as my practice, things that I find really rewarding are people who come in with uncontrolled high blood pressure, uncontrolled diabetes, especially cholesterol. Here recently, we've had a slew of those that just have difficulty controlling cholesterol. And for someone to come back after we started medication and to get really excited that we have now gotten a handle on things that are life-threatening for them, I think is very rewarding. And as a part of my practice, I really enjoy women's health, and so I do a lot of follow-up with especially older people who are elderly that don't necessarily need a GYN, or OB rather, who just want someone who can take care of all their medical problems. I find women's health is also very rewarding, and have had a special interest in that as well. As a family medicine physician, I find my role generally is just to make a difference, whether it's from the person who comes in with a sinusitis to the person who has coronary artery disease that needs a referral for chest pain. Or the person who comes in with high blood pressure, diabetes, all those things. Basically we come to work every day to make a difference. I guess something my patients might not know about me would be that I have 2 children. One is just about to be 5 and one is 2. They are reckless. It causes me a lot of stress and a lot of extra energy. And then I guess, in part of my spare time, I really enjoy playing tennis. I play Jackson League tennis at night and sometimes day league with some of the girls. And additional spare time, which doesn't always exist, I like to sew. And so I sew children's clothing and I monogram, which is something a little odd for a physician, I guess. But it's something I really enjoy. It takes a little stress off in the afternoon.